Hey y'all, Heather here. I wanted to give you an update. I went for my pre-op, as I said in my first video. I went and got my ultrasound. Let me give you the backstory. In 2018, I was diagnosed with fibroids. I had an ovarian cyst, and I was told I had the ATM as well as the BRCA1 gene mutation. So my primary doctor was the one that told me to go see a geneticist. So shout out to Dr. Sherry Gard. She is the best. My throat was a little messed up. I'll tell you more about that. Fast forward to between 2018 and 2021, we went through fertility treatments on and off. 2021, I had to have an open myomectomy, also known as a laparotomy. I hope you guys can hear me. And that removed 15 fibroids. My uterus was about 16 centimeters. When the fibroids came out, they were the size of a baby. My scar is a vertical scar from the navel down. I did lose a sister the month before I had that surgery, so a lot was going on. So in 2018, when I found out I carried the mutation, I also found out another sister had breast cancer. She carried the same gene. So the Lord healed her from breast cancer, but it came back in the form of ovarian cancer in 2022. And she passed away after a little less than 4 months. Her dying, not her dying wish, but the last conversation I had with her before she took her last breath was for me to not turn out like her and have the surgery. Fast forward to 2023. I went 3 months without a cycle. Went to see my OBGYN. She did blood work. My blood work came back that I was perimenopausal. So that was October. This year, as I told you guys in my last video, I decided to go ahead and have my pre-op appointment to have my total hysterectomy. So after my pre-op appointment, I went in for blood work and I got an ultrasound. The ultrasound showed that fibroids came back. There was a lot of them. They were large. My uterus was enlarged because of the fibroids. My right ovary was swollen and my right tube was blocked. At this point, I knew that I wasn't going to be able to have children naturally because I had a 0.02 egg quality. I did not ovulate and I was perimenopausal. So on the 16th of May 2024, I went in and I had a robotic total hysterectomy. I don't know how to say all the words. What they took was everything. They took my ovaries, they took my uterus, they took my tubes, and they took my cervix. What they had to do before doing the surgery was remove all of the scar tissue I had, and I had a lot. So my surgery was very complex, but by the grace of God, I did not need a blood transfusion. I'm sharing this story to let people know that although this wasn't the plan that I had for my life, it was the plan that God had for my life. My throat is the way it is because I'm getting my voice back, because with the breathing tube, I don't have a sore throat, but it has impacted me. I'm a little graspy. I'm talking low because I have to clear out the phlegm. So I am supposed to be coughing. I have done that. When they rolled me back in after surgery, I had the urge to go urine. When I sat on the toilet, nothing came out. I was on a liquid diet. So I did throw up twice from nausea that same night. I threw up the first time I got up to go to the bathroom. And then when my husband was leaving because they wouldn't let him stay, he turned back around and I asked him, did he forget something? He said no. And then I was like, can you pass me a ginger chew because I'm nauseous? And before I could get it open, I said, no, pass me a barf bag. And I threw up again. All I was throwing up was fluid because that's all I had in me. After that, I was fine. I went to the bathroom on my own. Every 2 hours, I was going urine. I went home on the 17th. Everything was fine. And today is the 18th. And I did BM on my own. I have not taken a stool softener. I have not taken gas X. I didn't have the gas pain because as soon as they rolled me out, I had gas. That might be TMI, but for those that need to know what the experience is, they want you to have gas. They want you to urine on your own. And they want you to BM on your own because between all the medication that they give you and the anesthesia, it can cause nausea. It can cause constipation. I didn't go through constipation. I haven't had nausea since the first day. I've been doing pretty good. I have a high tolerance for pain, but my pain level right now, I could probably tell you, is like a 7. And this is someone with high tolerance for pain. Because the first incision I had, where they made the knot at the top, right where my belly button was, that had to be cut or lasered rather, and redone because the knot was irritating me. Plus, they needed to get into the belly button. So they do 5 incisions. I'm not going to show my incisions. So many people on here show their incisions. I'm just not in the mood for that. Maybe I will in the next video. But I got on here to share my story because number 1, I said I would. And number 2, I understand that we don't go through what we go through for ourselves. Although we selfishly believe that. We go through what we go through to help someone else to get through to the other side. So as I said in my last video, if somebody is going through making a decision about having a hysterectomy, if someone is going through having a hysterectomy and they want to know what the procedure is or what it's like, or if someone just needs encouragement, I want you to really, really listen to my story. Did I want children? Absolutely. Did my husband want children? Absolutely. But our ways are different than God's ways. And God's plan is different, clearly, for our lives than our plan was. It doesn't mean that it will end without us having children. It just means that we won't have them the traditional way. Excuse me. Excuse my appearance, but as you probably know, I really don't feel like or care about trying to get cute. I am in the bed. I will probably, more than likely, if it's not raining tomorrow, go outside for a walk and do a video with you guys there. But I wanted to catch you guys up. This is day 2 of my post-op. What are some of the side effects I had? Again, I said I was nauseous and threw up twice. That's it. And it's not bad because you're on a liquid diet the night after, the night that you have your surgery. You're on all liquids, so it wasn't bad. You might not get nauseous. I would recommend going to like a TJ Maxx and getting the ginger chews, because as soon as you get nauseous, if you pop one of them in, the nausea goes away. I know a lot of people don't like ginger, but when you are nauseous and you need that sensation to go away, it's amazing. It's better to do that than to have to throw up, because it does impact your stomach. Take a pillow with you. You want to take like a small rectangle or a small square pillow where when you're coughing or laughing or getting up out of the bed, you can put that against your abdomen. Now, I know some people have the same type of surgery and they say that they can't put nothing up against their stomach, so you have to really be mindful of what your stomach can take. But I didn't feel any pain after surgery. I didn't feel any pain until the next morning is when I started really feeling pain in the, like where the incisions were. But the hospital keeps you on medication, and the medication that you're on in the hospital, it's a little bit different than what it will be when you come home. So when you come home, you have to really pay attention to your medication, pay attention to staying hydrated. I am okay. I don't necessarily know it has hit me emotionally yet, but when I got home and I was discharged, my surgeon told me I could get in the shower and just to pat the areas where the small incisions are. Don't scrub or rub, because there is tape on there and they will tell you when you can take that off. What else? Your bag. You don't need to take a lot if you're staying overnight. I had to stay overnight. I took a blanket, the little pillow for my abdomen. I took deodorant because you can't put deodorant on the day of surgery. I did brush my hair, but it's not looking like it now. But when I was in the hospital, I was able to brush my hair. That's up to you. Some people have braids, some people wear, wigs or whatever. Me, I just had a ponytail. Right now, it's not in a ponytail. It's all over my head. Another thing, what else did I take? My ginger candy. The hospital will give you the mesh underwear. They're great. They will give you the eye mask, the earplugs. The hospital I went to does Reiki, so they gave me lavender. It's like a Vicks stick that you use for sinuses and you stick up your nose. They gave me a lavender one for nausea. It works wonders. And they gave me this lip gel where you can use it for your lips and you can use it inside your mouth until you're able to lean over the sink and spit out water. I mean, spit out your, brush your teeth, spit it out and all that, because you do it leaning over. And that's not really a position you want to be in. Plus, it helps with dry mouth. And when you come out of surgery, for those that have had surgery before, your mouth is extremely dry. Some people from the incubation, they have sore throats. I didn't have a sore throat with either of my surgeries. Thank God for that. I just want to get on here. If you're someone that has to have a hysterectomy, it gets greater later. It is a very serious surgery. Even if they're doing it robotically, it's serious. If your body is telling you to rest. You do have to get up every 2 hours to keep the blood flowing. But when you take your medication, sometimes you'll be on the phone with somebody and you'll fall asleep. Sometimes you'll be trying to watch a movie and you'll fall asleep. That's okay. It's just your body telling you need to rest, because although you were put to sleep, your body has gone through a lot. And if you ask your physician or your surgeon to take pictures, they'll take pictures. The pictures are quite alarming, but it's good to know what is going on. I remember a nurse came in and did an ultrasound to see if I had urine left, and I didn't have any urine left because I had just, released my bladder. But when they did the ultrasound, you can see that there's nothing in there. So if that's going to alarm you when they do that first ultrasound after your surgery, don't look at it, because what you're used to seeing is not there. The reason I had to get my cervix moved, my best friend asked me, is because of cervical cancer. And a lot of times cancer hides. You have cancers that hide behind your tubes, they hide behind your cervix, all of that. If I roll it back to 2018 and I said I had a ovarian cyst that dissipated on its own, the uterine fibroids, they were removed, they came back, so I don't have to worry about fibroids anymore. But they do, when they remove your fibroids, they do send it for lab work to see if they had cancerous cells. So I'm waiting for those results. Prayerfully we got it in time. So I just wanted to share this journey because it's not an easy journey for women. I have a phenomenal husband who has been so supportive along the way. When I tell you I want for nothing during this time, he's been amazing. And I pray that when you go through this journey, you have a support person that will be amazing for you. Whether it's your mom, your dad, your sister, your cousin, your friend, your spouse. Because you are going to need somebody to help you at least the first couple of days. I did get up and do some walking this morning. My doctor told me I can do steps, but I have to do one step at a time. You can't do alternating feet. You also need to remind yourself to take deep breaths, and they will give you the breathing little thing that you can practice with. I will show you all my stuff in the next video. I'm sorry, guys. I'm exhausted. I really don't feel like showing it in this video, but I did want to share my experience. So this is me being vulnerable for the first time on the internet. It's a lot because Mother's Day was just on Sunday. My mother's not here. You know, I can't have children, and I lost 2 sisters back to back in 2021 and 2022. So it's been an emotional journey, but I realized that I have to press my way through and share my story anyway because somebody needs to hear it. So I pray that you guys have a great rest of your Saturday, because today is Saturday, May the 18th, I believe, because the 16th was on Thursday. Yes, today is the 18th. So this is post-op day 2 for me. Post-op day 1, I slept, so I did not get on. So in my next video, I will show you what they gave me. I'll probably show you me going on a walk. Also, the day after your surgery, you're back on regular food. Don't be alarmed if you can't eat as much as you used to be able to. You're probably not going to be able to, but your appetite will come back. Well, I pray you guys have a blessed rest of your Saturday, and I'll see you in my next video. Bye.